Okay, we are live and recording. Welcome, everyone, to this weekly call, and super excited to get things going and jump right in, um, and uh, and hopefully the technology will play nice as I get this thing moving. So. Um, I see that Mary was having trouble with audio. Did you get that figured out, Mary? Maybe not. Okay, so hopefully it sounds. I think others are able to hear us. Okay, is that correct? Okay, good. I can see a few people's heads nod, so we're gonna keep on keeping on. So we'll jump into the update section here, and Joan, I think it. I'll pass it over to you. Do you have anything, any slides or anything of that nature, or?
No, I didn't put any slides together. So I'll just give a brief update on where we are with the guidance revisions. The internal revision teams have or are in the process this morning of completing their first draft of revisions and of all of the guidance. So we had a team kind of looking at each section. The section I was the lead for was, for example, the health and sanitation guidance. If my team was any example, we had a very great, robust conversations. The teams included licensors and folks from the community systems team and people from the program team. We were charged to look at CDC guidance. We read research papers or scientific papers if they were available. As you know, is much of the science around this is really emerging. We also looked at extensive stakeholder feedback. You also know, in particular, last week we hosted hundreds of childcare providers in small groups and had some really great conversations. Our call last Thursday, we had 20 ELD staff facilitating and note-taking with certified centers. So, and then we got a tremendous number of responses, nearly 4,000 responses from families on the family survey. So really, I think lots of great input and perspectives. And of course, you know that the virus is making the timeline. If you're tracking what's going on, you know that the governor yesterday banned indoor gatherings of more than 10 people and is now requiring mask wearing if you can't outside, if you can't be further than 6 feet apart. So we are very much, as a state and a country, still but I know that there is thoughtful consideration of, given that you can't socially distance in childcare realistically under most circumstances, how are we making sure that people that are working in childcare are safe? So we have to look at all the ways that that can happen. So we are on track for meeting the August 14th deadline for the guidance to be released. This week, we will be starting today reviewing the draft internally. I think Miriam will get a briefing this week. She's been very involved in the group size revision team. So I think we're going to have a really great product, a very thoughtful, intentional product when we're all done. One of the things that we're really thinking about here at the Early Learning Division is how to use these childcare provider calls going forward. What ought they be? We began them because we really saw what felt to us like a widening gap where we kept having more and more people with questions and people not feeling as though they could really get answers or they couldn't get them timely enough. There's learning, there's a limited utility to information that's, you know, essentially passively received. And that we know if we really want to make a lasting change in people's behavior, so for example, successfully implementing the guidance, which we really need to have all child care providers doing, then we're going to have to be using other methods. And that's really why we have all of you. So I'm really just forecasting that we're going to want to be talking more in the coming weeks about how are we really using all of our collective resources to work synergistically with each other to make sure that as we head into the fall and what appears to be by all data a continuing rise in cases, how are we going to support childcare to operate safely? What are all the things that each of us will need to be doing to make that happen? What will QIS staff need to be doing? What will inclusive partners need to be doing? What will Western need to be doing? What will PSU need to be doing? What will ELD staff need to be doing? What licensors need to do? What will I need to do? What will John need to do? So I'm really trying to communicate that this is not arriving at people being able to fully understand the guidance, understand and commit to and buy into the importance of operating under the guidance is going to take all of us working together. So more to come on that. I will say, I know I've talked about this before, but it continues to come up that providers appear to be hungry for an opportunity to connect with each other, to talk about daily activities and safe operations. And I want to have an intentional conversation at one of these upcoming calls about what that looks like, because I feel like we should be able to meet people with that expectation. And I know many of you are already doing what I assume are versions of that, but I'm wondering how much broader we could potentially go. What kind of access can we create for people to connect with each other and with you to help support successful implementation, because people are challenged by how many things they can't do with the children. And they really need and want support with what they can do. They need ideas. They need to share with each other. They need to have possibilities, because I think some of them are really struggling. We had somebody very poignantly say, you know, is this even preschool anymore? And I just can't stop thinking about that, because for the children, it still is. So I feel like we really have a responsibility to them and to their families to figure out how to make it the best early learning experience they can ever have, because it's the only one they're ever going to have. You all know this. You're only 3 for 1 year, you're only 4 for 1 year. So you're only 2, you're only 1. I mean, all the children that we have in care, how are we supporting folks to understand what they can be doing with them safely? And we certainly don't have all the answers yet, but I think we have a responsibility to keep on trying to help people figure out what that looks like. And I've heard a lot of really innovative ideas on these phone calls. I'm sure you all have too. The question is, how could we more effectively spread those and make those known and help people who are struggling to implement be able to implement successfully? The last thing that I want to say, and then I'm happy to answer questions, is that we are now working in some different ways with the Oregon Health Authority associated with reporting outbreaks in childcare. And you may have seen some of that reporting about the kinder care. There are definitely more outbreaks happening in childcare. I'm assuming you all are starting to be aware of that as well. Those are going to be posted on our website. We are working closely with OHA because, of course, we really want to understand, if it's possible to understand kind of, what's behind those outbreaks, how well were people being able to implement the guidance, were people feeling like they had all those things in place. We need to be learning from what's happening so that if we need to change what we're recommending, what OHA is recommending, what we're recommending, we need to understand that. So it's a bit of a work in progress. And one of the things that we hope that the guidance and this closer work with OHA is going to do is make it clearer to everyone what needs to happen when there's a case in childcare, because we do hear that some providers really are having to make like a lot of phone calls, or that local public health is telling childcare, depending on regions, different things than what's in the guidance. We've heard that's happening, for example, out in Central and Eastern Oregon. So I just want you to know that that work is ongoing, and that Miriam is dedicated to being able to have the best possible data on what's actually happening in childcare with COVID-19 cases, so that we can make sure that childcare providers can have that information as well. So I think that's it, John.
Thanks,
Happy
Joan.
to answer questions.
Are you able to hear me?
Yep.
Okay, I was having additional new issues, but I think I'm back, at least auditorily. So I see in the chat box there were a few questions for you. Eva had a question about will provider calls be continuing? I cut out for a little while. I'm not sure if you answered that particular one.
We do anticipate that they will continue, but I believe that they will be in a different form and probably at a different frequency, because I would like to see us using other adult learning strategies, both at the CCRNRs and also through what might be happening from other parts of ELD, to make sure that people are getting their questions answered. So, licensors are such an important source of information for childcare providers to answer their very specific questions. So how do we make sure that everyone that has a licensor knows how to reach that person, how to get their questions answered, and that they should really be starting there. But yes, we anticipate continuing the calls at some frequency in some format. Yep.
Thank you, Joan. Can you confirm if there's a call this week? Are there calls happening this week?
There are not.
Thank you.
No.
I appreciate that.
Yeah. Let's see, 4,000 responses. Well, the thing about the parent survey is that we had an interesting number of providers that also completed the parent survey. So once we cleaned them out of there, because of course we really were trying to understand the parents' perspective, I think we ended up with something like 3,200 or 3,300 responses from parents. So actually quite robust, really, responses to the survey. The responses on the specific provider survey, I think that was over 400. And lots of, kind of for each section of the guidance, there were like open-ended comment boxes. So I know I can just say from like the face mask comments, I think there was like 263 comments just on face masks. So people really very much took advantage of the opportunity to share their perspective there. And yes, the physical distancing activities that keeps kids social. Yep. Yes, lots of, I think the more resources that we could make available to childcare about what they can do, what's possible to do, what's fun to do, what's feasible to do, you know, what kids like under the circumstances, I think the better. We also, I guess I'll just say one more thing. It made me think about all of you when I saw it. We received, actually Miriam received a video from a child care center preschool up in the Portland area that they made to show what pickup and drop off looks like now using the guidance. And I thought to myself, there's a, like, it'd be really cool potentially. I realize this is just more me riffing off this idea. One thing that people might consider doing is having people videotape some of the things they're doing that they think are cool and different and sharing them with each other. Like, there are a lot of ways that people could share what they're doing, and also communicate with families about what to expect, which was part of what they were doing, was like, this is what it will look like when you come to our center now. These are the things that will happen for you. So just, I think it's a time that in spite of kind of everything, it would be great to be thinking a little innovatively and creatively to support children and families and providers.
Thanks, Joan. Are there other questions or folks that would like any clarifications? I can scroll down and kind of see cameras, but Sydney's supporting me if you're waving your hand, so.
No hand waving, John.
No hand waving at this time. Well, thank you, Joan, for those updates. And all right, so if there are no further questions related to those subjects, then we will move into an update on the DHS side. Regina, I saw you're logged in. Are you ready to give us a little update?
Yes, I am. Good morning, everyone. So hopefully you've heard by now, but DHS did receive some additional funding to extend out the $0 copays for an additional 2 months. So any family that is reapplying for benefits or is a new applicant through August 31st can receive the $0 copay. We are looking to see if we can extend that out even further, but at this time, we're looking at the August 31st end date. And then the other update is just that I know there has been a lot of questions and confusion about the CPR first aid requirements for the license exempt providers, and DHS has been having some conversations, and we've decided to align with whatever ELD does for the licensed providers or the ECC providers. So we are going to do a rule change on the DHS side that will allow the online CPR first aid for our providers as long as ELD has that in their rule for the ECC. So we're in the process of doing that, but we will be backdating it back to the beginning of the state of emergency. So I hope that clarifies things, and I'm sorry that there's been confusion about it. It's one of the little pieces that sort of got lost in the COVID shuffle. So does anybody have any questions about either of those things?
Christine's got her hand raised.
Hi, I just wanted to mention to remind you that that is only available in English right now. And I know a lot of our DHS providers do not speak English. And so I know this has been an ongoing issue both on the licensing side, but especially on the DHS side. So I'm really concerned about that.
That the online, there's no online CPR classes anywhere that are in anything but English?
That's correct. And CPR is not something that we can, at this time, I mean, at least it's not been authorized yet, but something that we can just develop. It's through an actual certification company. So like Medic First Aid or Red Cross, you know what I mean? So it's an actual certification. It's not something that we can just throw together without, the state approving that. So I'm worried about providers who can't take that or taking it and not understanding it. You know what I mean? To check the box. And so we have a lot of, I mean, probably better than I do how many languages are in there. So
yeah,
I don't have a great answer for you, but
Jessica has her hand raised too.
You mentioned that it being backdated to the state of emergency. Does that mean that if a provider was moved to failed status because of not meeting that requirement during this time, they will be now put back to active?
yes. And my understanding, so, I'm sure you guys all can relate, working not in an office and being around your coworkers. I guess DPU was under the impression that the online class was okay, and I don't think that they've been denying anyone for that. If there has been a provider that's been denied for that, then I definitely think that they can reach out to DPU and we can see what happened. But I guess DPU thought it was okay, and they have been approving providers. So I'm hoping that there isn't very many that were denied.
Taya?
Okay, so I'm one of the people who was pretty confused, and I probably am still kind of confused, but the last conversation I had about this was, I heard was that they were getting this sort of like 90-day, like, it's okay if you haven't taken anything for the first 90 days. We didn't want to use the term waiver because a waiver is a whole separate process or whatever. So and this has been going on for
that is still correct.
More than 90 days. But so what about, so those folks now who have entered the system in the last 90 days who are just kind of hanging out there, are they all now, do they all need to like immediately go take the online portion, or how are we supposed to address those folks?
That piece of it we're also very concerned about, and we have reached out to ELD leadership to see how they're going to move forward with ECC providers that are in the same situation. So we have not heard back yet. I'm hoping to hear back hopefully this week, and there'll be further information as soon as we figure out, because we're going to align with whatever ELD is doing.
So we'll sit tight on those, but from now on, whenever anybody contacts us, we'll just get them from this point forward, at least we'll get them into the online version then.
Yes.
Okay, thank you.
So I was just curious, Taya, you were referring to a 90-day, is that on the DHS side, or were you referring to what was provided as guidance from ELD?
I'm talking about DHS, and this is like, it's almost embarrassing because I can't even remember who I was emailing with. I exchanged some emails back and forth because what happened was we had a provider call asking about a waiver. There's that whole other waiver system when there's not a class available within X number of days and X number of miles, not recalling those all off the top of my head. And then I thought, well, what is going on with that? So then I reached out, and I don't remember who from DHS I talked to. And the response I got back was like, well, it's not really that waiver, but they do have 90 days before they have up to 90 days to take the class now because of this state of emergency. And then I said, okay, but we're going to have people who start hitting that. It's been 90 days now, and now what? And so I think that that's kind of where we're at now.
Okay. I can see Jessica raising her hand there.
And Eva after that.
Oh, okay.
Regina, I have a quick question.
I think.
Do you want to go, Regina, first?
Oh, what?
I thought you were talking.
Did you have a
Sorry.
question?
Yeah, I do have a question. So, ELD.
Oh, no. Okay.
Office of Child Care, is my understanding that they are honoring the certifiers for first aid and CPR, that they've provided an extension that many of them are good for 120 days beyond the original expiration date. Is that something that DHS will also honor for license exempt providers?
So the place that they've gotten their certification from has extended it out? Like they don't have to renew it, is that what you're saying?
That's correct.
I believe so, but I want to double check with my team just to make sure. But that would make sense. Yeah.
If you could, that would be great. Thank you.
And just for clarification on that too, Regina, the companies themselves recommended a 120-day extension, and then ELD has adopted, I think in almost every case, if that company has said that that's an available option, ELD is honoring those 120-day extensions too. So.
Okay, then DHS would want to align with that for our license exempt providers. So I will add that to my rule change list.
And Regina, I'll send you the document that Ronnie has been working on that describes those extensions.
Perfect, thank you.
Eva?
Yeah, so I just had a question about license exempt providers and the hours that they're paid for doing training, and understanding that they don't get paid for classes that they do online. Does that still hold for first aid CPR classes or hybrid classes? Just wondering what that looks like.
Yeah,
if it's different.
We have not made any changes to that currently. I don't think that has been brought up. Has that been an issue? Have you been hearing that from providers?
I think it's an advocacy point within my team, that they really want people to be able to access those dollars, and when everything is online, it's something less in the provider's pocket to support them and their business.
Okay, I will take that back again to my team and we'll have a discussion about it, and hopefully I will have an update for you guys soon.
Thanks, Regina.
Yeah.
Are there other folks in the queue? Sydney?
Nope, I don't see any other hands. Oh, wait, Karen?
Hi, sorry about that. Yeah, what Eva was mentioning is something that I think we just don't realize. The online training that they're taking is not like a webinar, something recorded, but it's the actual training that they used to get paid for when in person. Is that correct, Eva? And I think that I would agree to advocate for that. So just my 2 cents.
Thanks, Karen. Any other comments, questions for Regina? Hearing none and not hearing Sydney say there's any hands raised. And I think we'll move on to the next agenda. Thank you, Regina, for the update. And I'll make sure to get you what I have around our current CPR first aid information. And I know our leadership under Amy Joyce is helping us kind of review how we want to proceed with any sort of hybrid or in-person activities related to CPR first aid. So hopefully we'll have some updates on what we're doing there.
All right, sounds good. Thanks.
Excellent. So the next agenda item is the Introduction to Registered Family Childcare Part 2, affectionately known as IRF, and that'll be the last time that you hear me refer to it that way because I don't know, that just doesn't sound right. So anyway, the topic here is related to doing this class virtually. So I know there's been a lot of interest in that, and I just want to check to see. I don't think that Margie has made it on yet. And feel free to cut in, Margie, if you want to take this one over, but I will go ahead and speak to this one. So we have actually been talking with Tammy on our licensing, Office of Child Care side, and Amy Joyce and others to really look at what are the best ways that we can help ensure that these classes are available, especially in light of some of the new processes that are being stood up on the licensing side, where they're trying to figure out how do we help providers that are trying to get registered or move from registered to certified, or if they were license exempt and we've been in their environment, how do we help start moving these things forward? I think the same thing applies as we're thinking about, and I think Toby brought up really a great point last week around there's providers that have been, registered for a number of years, and then they have decided to kind of reopen after they had closed for the pandemic period, and now they're jumping back in, but they don't have the introduction to registered family, and they're functioning off of the old overview. And so our suggestion and what we're wanting to move forward on, and want to see if you have any comments, feedback, or concerns, is we really want to be able to move this class to an online format. And so we want to make sure that what you're doing, though, is that you're engaging with your licensing specialist in your region, inviting them to be able to do the Part 2 online with you if they're available. If they can't or aren't available, then it is okay for you to proceed to present that with your CCRR staff. But what we have is the online training in the PowerPoint presentation that you can utilize. I mean, it's all the same stuff that you guys are using. There's the evaluation template and agenda, and I think there's one more sort of attachment that goes along with all of that. There's a packet that can be sent out electronically. You can choose if you want to be trying to print things and mail them prior to, but we believe that this is a class that is appropriately able to be transitioned to an online format, and want to be able to make that happen for you guys as you're working with those providers, especially the ones that have had a visit from a licensing specialist prior to, so it could have been a regulated subsidy provider that they've been in the home previous to our COVID situation, and so then they're proceeding with allowing them to get registered through their sort of hybrid process. Those would be the types of folks that we would want to ensure that you're able to quickly provide these virtual classes for. And I think there's probably a couple other examples that aren't coming to mind, but I think it's those folks that really haven't had the new format and really should get it as soon as possible. So I'll pause for a moment and see if there's any questions. Who do you got, Sydney?
I've got Shannon and Jerry. Are you raising your hand? No. Okay, so just Shannon then.
Oh wait,
And
Jessica. Yeah, okay. Go ahead, Shannon.
John, can you hear me?
Yes.
Okay. So how do you discern when providers are calling for the IRF? I mean, a lot of times it's registering online, or they may talk to a staff person, but I mean, are we gonna have to sit there and investigate each person we talk to if they're this type of provider? I can only give you the IRF. I can't give it to somebody who's just starting up because they're not licensing right now. So how do we discern? I mean, go through that process.
Yeah, that's a good question. Describe to me how it would work in a normal situation, Shannon, if we weren't in lockdown. So providers attend the IRF Part 1, they do that online most of the time.
Yes.
Is that correct? And then the in-person component was the part 2, and that's when they're proceeding with the registration process. Do people take do they take the IRF part 2 prior to submitting? Do we have it going both ways, where they're submitting to become registered, or do we have people taking that before they've done that stuff? This is my ignorance showing.
Well, as far as if I'm understanding you, so they take the part 1 because, well, for example, on our website, we list out part 1, go here, and then when you're done with part 1, come back and register here for part 2. And so most of the time we're not talking to someone because they just come in and they register for the class. Sometimes they'll call though and ask about it, and we'll sign them up, but it's not always where you're talking to someone. They're just registering for the class. So I'm not discerning what type of, where they're at in the process, or a lot of times it's a brand new provider coming to do the class. It's a rarity, I think, that the scenarios that you're talking about. I mean, it happens. There's plenty that are starting up, but you're talking to 1 or 2 compared to the 5 who want to start. So how do you figure that out?
Well, and so I appreciate you describing that a little bit about how it's been set up in the past, and I think I'm leaning more toward you guys utilizing a process that you have always done as far as individuals being able to attend, but now it would be online. I think we want to make sure that as much as our marketing is provided, that people know, like, we really want to provide this for the folks who are in the process with, trying to get licensed, and they've been talking to their licensing specialist and that sort of thing. But if people sign up for that because they're sort of on their own track, and you are providing them the online links to get into that training, I mean, I think essentially they would be attending, getting that under their belt as, having their certificate for those, both either the part 1 and the part 2, and they may not necessarily be able to get through the full registration or certification process, depending on, I think, licensing deciding, who's prioritized, or if they've even been in that environment in the past. And so I don't think it would be terrible for them to take it and get it. It just might put them in a queue for a while before they're sort of on the sort of priorities list to get registered. But just that's my thought around that.
You have some comments in the chat box too.
Say that again.
You have some comments in the chat box about this too.
Well, yeah, I'm having trouble seeing the chat box. So if folks want to come off chat and
Well, I think if you make it really poignant at the class, that if it's a new provider, it could be a while before you get licensed. Long as that's mentioned, I think it could be okay. I just wanted to make sure you guys were okay if we offer the class, that if it's new providers, I just don't want to give them the illusion that they're going to be moving forward right away.
Yeah, I'll seek a little clarity on how I think hearing what you were saying about how the process normally went, and that there's really not a set system probably across our CCRNRs to be able to easily vet who's signing up for those. I want to check with our licensing team to make sure they're okay with this. I mean, to me, like, if I think in that part two, as people are presenting, they can say, you know, you may be in the queue here a little while. Licensing is still working on how they're prioritizing who gets, you know, fully registered based on, you know, not being able to go out and do face-to-face visits as frequently or as effectively as they used to. And so I think that bit of a disclaimer would be okay. And I think it's also, from my perspective, important that people get those classes and are ready to jump in when the time comes. So,
John, we have Jessica and then Karen.
All right, Jessica, go ahead.
Yeah, I have a couple questions. So the first was similar to Shannon's, and I can just speak for us. I think it would be, unless we can get specific information, there's no way for us to know who has previously had a visit or whatnot. And so being able to open this up to anybody, but just having that disclaimer, like Shannon mentioned, that, you know, it may be a while. However, for us, I think we have an interest list or like a wait list that we've created during this time. And I want to say we have upwards of 10, 15 people on that list. And if we can get them to at least get this portion complete and ready, that once visits can happen and they can get licensed, I think a lot of them would like that. So if we can do that, that would be great. And then my second question is around the USDA CACFP portion. Are we required to invite them to participate? And if they are unable to, can we still move forward? Same thing in regards to the union.
So that's all part of the IRF part two?
Yes. So when we delivered them face to face, we would have obviously the licensing specialist, somebody from USDA CACFP, and then union. If we invited them, they typically didn't come, but it was my understanding those are requirements for them to be invited.
Yeah.
So I just want to make sure that you had mentioned that if the licensor can't attend, we could move forward. I just want to make sure that if those individuals can't attend, we can still also move forward.
Yes, that would apply the same for the others. I would say, you know, trying to schedule it at an appropriate time that meets, you know, their needs would be great. But you can say, here's our schedule. You know, I think what you're required to do is give people, like, I think on the bargaining agreement, it's the collective bargaining agreement, it says something like 30 days notice of when those things are being scheduled or something to that nature. So if you guys are scheduling out in advance, then you can provide them your schedule of when those are and invite them to it, and that you wouldn't have to cancel if they can't come.
Yeah. Karen and then Eva.
This may be part of my conversation in the next grouping, but two things. Because we have so many providers, we don't know specifically when they've connected with a licensor and they're okay to open. So I think what Lynette mentioned is that, yes, we're able to just go ahead and provide the training, but then it's up to licensing to follow through on that. However, I need to know, because I'm being asked by preschool promise providers, when will licensing come back again? Because the preschool promise people who were awarded need their site licensed. So just kind of a better understanding of when or if that's going to be on the table.
Thanks for that, Karen. I don't believe we have any of our folks from the Office of Child Care on. If we do, they can cut in. But what I'll do is seek some clarity on sort of the next steps. And I do know they are working to get some of those, what I would consider the first wave, registered. But I know that Amy took back quite a bit of information from you all related to priorities for Preschool Promise and some of our other expansion that is occurring. There are sites that are going to need to be licensed, and how are they going to go through that process? So I think we'll try and get them on for our next Tuesday's meeting, so we can get some clarity for you guys around what they think might be the next steps for those programs. And who was next? Was it?
We have Eva and then Taya, Jocelyn.
I think just to tag off of what Karen said, we're starting to hear from our school districts about back to school and licensed care, and are hearing specific need for people that are new licensed programs opening in some of our most rural communities. And I just continue to have concerns about people that are interested in becoming licensed, and now they're deciding to be recorded programs or exempt providers, and puzzle piecing things together just on the verge of not being legal or being underground care. So there's pressure coming from our districts, and I just want to be sure that there's an awareness of that when we talk about licensing new providers. People that want to be licensed, they haven't had anyone in their home yet, they want the trainings, and we're holding them back, and we're kind of pushing them to a spot that's not really what we want in childcare.
Yeah, I appreciate that comment and clarification, Eva. And I think that I'll put both, try to get an update on both the idea of what do we do around programs that we know are moving forward with needing to open up new sites for Preschool Promise and our publicly funded programs, and then also just the general provider base, and I'll make sure they understand sort of what you're hearing in local regions as potential concerns, that we definitely don't want people who are waiting and wanting to go through the legal process to go do something drastic like just providing care without registering. So important. Thank you.
Hey, Jocelyn.
Okay, so I think, at least with what I'm hearing, we're talking about maybe at least two different things, actually probably a lot more than two different things. But I'm sitting here thinking, am I going to walk away from this understanding what I'm supposed to tell my team to do with IRF Part 2? So far, no, I don't understand it. So what I think I'm hearing, and we had kind of heard this from some of our licensors, is like there are these programs, some RS programs that want to become licensed, or it sounds, I wasn't here last week, but it sounds like some examples were brought up about programs that used to be running, so licenses are familiar, or so however you want to characterize this group, there's some folks that licensing is really wanting to move along, which seems like it makes a lot of sense. I wonder in that case if we might be able to look at things a little differently, where licensing sort of initiates and gives us the green light, like, hey, here's this group of folks we'd like to see go through an IRF Part 2. And then we know that those people kind of fall into that category. We have this whole other group, which I've heard some other directors talk about, who just are the people who have always called and said, hey, I want to start a childcare business. And I'm feeling really unclear about what to do with those folks, because it doesn't seem like at this point there is actually a clear path to them on how to get from, you know, the very beginning to actually opening up and operating a program. And so I'm just thinking, like, and just having them take that class and then say, well, someday you can probably get licensed if you take this class, but we can't tell you when or exactly how from this point. Like, that doesn't seem like great service to people just trying to enter the system either. So I'm just, and maybe there are more groups and more scenarios, but I just, right now, if we're supposed to leave today and start doing a new thing, I don't really understand who we're doing that for or exactly what we're telling them their options are. And maybe we're just starting the conversation today, but I just don't feel, I'm the only one, maybe the case, but I don't feel like I would need, like, I know what to do from now, get off this call. What are we actually doing with IRF Part 2?
Right. I appreciate that, Taya. And I was actually proposing that we get to a place where we can sanction you guys to do IRF Part 2 online, but I needed some feedback from you, which is what I'm getting today. So what I want to do is go back to our Office of Child Care folks and say, are we okay with providing this training to anyone who's interested? You know, that could be one version of how this works. And if so, what is our sort of messaging that we should be providing as our disclaimer for folks who may not be in the sort of first priority group? So you're waiting for feedback from me based on what I get back in comments from our team. But I also think that distinction of what you just proposed, like if we don't want to open the floodgate because we don't necessarily want to just keep people, you know, sitting and waiting without further communication, I think your suggestion around licensing folks saying, hey, we do have a group of people that really are on the path to getting their registration and we want them prioritized and here's a list, can you provide a class for them? I mean, I think that would be plan B. I think what I'm hearing from folks is that we would like to be able to offer it for any of the folks that are in line and hoping and waiting, and then trying to have some clear messaging around what that means for the ones that aren't in the first tier priority group. And does anyone have concern about that?
Christine raised her hand, but Mary also had her hand up before that. So I'm not sure if Mary wants to speak to that. You're muted, Mary.
Can you hear me?
Yes.
So, you know, before it used to be that if licensors were not able to attend, that we would be able to do that training part that the licensors usually covered. Now we don't even have the, you know, the forms and the materials that they use. I think if the licensors would just share that information, that they are the ones that it's, I agree, ideally, they would be the ones that would be giving that information, but if they're not able to, that we could do it as we had before and cover that part and then connect them with the licensors afterwards.
So you don't have what the licensing specialists present?
No.
And at this point, you've been doing IRF Part 2 with a licensor?
We were told that the licensor had to be there.
Okay.
That, you know, which was really, you know, we want them to be connected to their licensor and know their licensor and get that information. But if the licensor, and this was an issue, you know, sometimes even before all this, and also it's a burden on a licensor if you just have one or two participants to make that time, you know, to be there, especially when it was in person, you know, to be there to present that information for just a very small group of people.
Yeah, I mean, I think optimally we want them involved. We want them to be connected. We want them to be partnered with the CCRR. I feel the message that we heard was that, you know, you do your best to get them there, but that you could do the presentation if they couldn't.
Correct.
But it's a nuance to know that you don't have the component that they are providing. So I'll make sure that that's you know, I think if Office of Child Care would like them to be there no matter what, I mean, I don't think it's any more of a burden to do it for one person or 20. It is what it is. So if they're supposed to be there, that'll be part of the message that I'll bring back to you guys. Like if we want them there no matter what, well, then we'll make sure that you guys are you know, working that out with your specialists and getting them engaged. But if Office of Child Care is fine with you, you know, doing your best, but they aren't able to attend, then we need to get you a little bit more information. So to be able to present that part.
And there could be a way perhaps to make sure that they connect with the licensors after that. You know, that your next step, okay, we've done that part 2, and now your licensor is going to contact you, or you're going to contact your licensor to kind of sign off.
Yeah.
Christine?
Thanks. I just wanted to bring up, John, in your summary, I was hoping you could add to the priority list school age programs. I know our, at least Portland Public Schools, which as everybody knows is a pretty large district, but our whole Multnomah County, the schools are very much depending on opening school age programs in order to do their hybrid models of partially in person and partially virtual learning for students in the fall. And we just don't have programs to accommodate that. And so I know they're working right now with the programs they typically work with, which in our area is Champions / Kinder Care and the YMCA. And so they are very much depending on opening new licensed classrooms in different buildings. And so when I was telling them that licensing isn't going out right now, there was panic. And so I said, don't panic, let's make sure ELD leadership knows about your plan and communicate that up. And so I'm hoping the schools have communicated that up, but I just also wanted to reiterate that that's a big deal in our area. And it would be multiple sites, not just like 1 or 2 sites.
Yeah, no, that's
Hey, John, it's Joan. I guess I just based on this conversation want to say, and I think Amy talked about, licensing is working on the restart of field operations. So I don't want you all to be thinking they don't know that there's a need and that they're not trying to figure out how to do it. What field operations is going to look like, it's probably going to be a hybrid, very much like the different kind of hybrids that are emerging. Like, what are the maximum number of things that can be done not in person? What are the minimum number of things that have to be done in person, and who needs to be present when those things are happening to minimize, the risk of people coming into close contact with each other. So I know John and I will make sure that Amy is aware. That's the other reason why this group size conversation is so important, because we know right now with the limits on group size, that is making, that's increasing pressure as well. So I guess I just want to reassure, I realize it's not really an answer, but that I think everyone at ELD is very aware of the coming pressure with the startup of schools and trying to figure out, as quickly as possible and as safely as possible how to get all this restarted again.
Yeah, thanks, Joan. That is also what we communicated. I think I was trying to manage their expectations of, things are moving a little differently right now, and it might not be possible to get your license in 2 weeks, where in the past, maybe licensors were able to do that. So yeah, it's a little bit of that too.
Yeah, that's helpful. Thanks, Christine.
Yeah.
Thanks for that extra assurance too, John, because that is clearly how the Office of Child Care has been talking about their work to get things restarted. Were there other people, Sydney, with questions, comments?
I don't see any hands right now.
So just to reiterate, I'm going to take back we're not jumping into IRF Part 2 just yet. I want to make sure that we're all on the same page with your questions and needs that you've brought forward. So I will follow up with our Office of Child Care side, make sure that we are okay with doing this for anyone who is looking to become registered, see if we can get an update next week around where we're at with process for hybrid or limited licensing visits for programs. And then if we're not able to do the IRF Part 2 for anyone that's interested, we'll get you some clarification on how we think we should connect to get to those other folks that are sort of in that first priority tier. Does that all make sense? And then I think the other part of what we're going to seek clarity on, which is not related to the IRF and not specifically related to the IRF, is just sort of how we can ensure that programs that really are moving towards needing to open very soon, whether they're publicly funded from the Early Learning Division or they're school age programs that are going to be operating multiple sites or expanded opportunities for childcare, we need to know sort of where we're at with that. So I'll get feedback on that. Any other things that people were hoping I was going to follow up on related to that particular conversation? Okay. Thank you for that feedback. The next conversation is related to preschool promise expansion, but particularly focused on giving you a little bit more information about what is in the hopper and what's on the way for expanded staffing of the CCRR programs. And I just wanted to check in. Andy, you're on the call. Do you want me to take lead on this? Do you want to talk and we tag team? How do you want to approach this one?
I don't have a preference, but I was not on the call last week, so if there's an immediate jumping off point from last week's call, go ahead, John, and you can take that, and I can jump in with additional information.
Okay, I'll start. So, well, although I see Joan, I didn't know if you looked like you were trying to chime in. I just wanted to make sure that I'm not.
Nope, I'm here. I'm just here if it's helpful.
Okay.
If there's something you want me to say, so.
Perfect. You can feel free to jump in when and if needed. And I just wanted to make sure I wasn't talking over your attempt to break through. So where we're at, Andy and I have been working on various aspects of getting the amendments done for the preschool promise positions. And I know you guys have heard us talk a little bit or allude to a little bit of where we're headed, but we have a statement of work drafted to amend funding to CCRR. So you guys have an amendment on the way for other funding for your program, but there will be an amendment all of its own for preschool promise support positions. And so that is moving pretty rapidly. And what we have now is a statement of work that is really describing two things. One is a preschool promise specialist position, and the other is a preschool promise instructional coach position. And so what we would be doing based on a funding formula related to how many preschool promise providers you will have in your region and slots that will be funded, there will be a sort of a percentage of based on your region size with those particular programs, how much FTE you would get for those particular positions. And it ranges between 0.5 for both functions to 1 FTE per position to in some regions where there's many more providers, a little bit more than that. And I know that you guys, in order to do your planning, are hoping to get that level of detail. That is on the way. We're getting very close to having the number of positions or FTE and funding levels that you will be seeing in your amendment. But the statement of work is particularly focused on what the duties are within those two position types. The preschool promise specialist is really focused on that foundational support of those preschool promise programs, ensuring that folks are interacting in Spark and what that what it currently is related to Spark, and helping them maneuver through that. In addition to what I would say a quality improvement specialist does related to continuous quality improvement of programs. We have drafted in this statement of work that those providers would be interacting in focused childcare networks, and that would vary based on what your region is already doing, potentially working with programs that may be funded for preschool promise, and we would work with you closely to figure out how those activities are structured. It also depends on how many programs you have that are Head Start programs that are going to be preschool promise, school district programs. And so the design of how that quality improvement specialist works with the particular programs in your area will potentially be a little bit different from region to region. But that particular position is really focused on doing what a quality improvement specialist does, but they're going to be only focused on preschool promise funded programs. The instructional coach position is sort of taking this to a new level as far as you have preschool promise programs that are that have had public funding before in some of your regions. The quality improvement specialist is going to probably spend a lot of time with preschool promise programs that are brand new to this, that have not interacted in public funded programs, that need someone to help translate. Like here's what you've been doing in childcare around licensing, and now we're moving towards meeting preschool promise standards and the operating manual of how to be a preschool promise program. So that's sort of the foundational level that I was describing with the quality improvement specialist. And then the instructional coach is really taking it to the next level, which is really individualized coaching activities with preschool promise programs. And so they're going to be the folks that are focused on meeting and exceeding the preschool promise standards, getting out there doing observations and data analysis, and helping them set coaching goals with the instructional leaders, with the system leaders, also interacting with the early educators themselves. But I think it's really focused on that more individualized, how do we ensure that you are meeting and exceeding preschool promise standards. So I think the two positions will work together very closely, and based on the number of providers that you have in that area, you may have one FTE fulfilling both of those roles. It kind of depends. Or if you're a larger region with a number of providers, you may have multiple FTEs. So that's part of what we're moving towards to get you some additional feedback. But that is sort of the general description of what those positions are going to be focused on. I'm going to pause there for a second because I think there was some additional things that Andy may wanted to stress related to this, and you may all have some questions.
Yeah, thanks. Thank you, John. That was really great and hopefully helpful to think through about what's to come. A couple other things I wanted to stress is that in bringing these folks on board, both in the quality improvement role and the coach role, we're really looking towards the NEYC definition of technical assistance. And so when we're looking at the different stages of technical assistance that they describe under the umbrella, you can think about the quality improvement specialist position as a consultation, and then the coaching as a more defined, more specific, more one-on-one relationship. And so one thing that we know that for these folks and for you guys too, that will be coming into these roles and be working with our preschool promise providers or grantees, that they're going to need supports too. And so there's a couple things that we are also in process of developing to support these folks in these roles. One of them is going to be some onboarding for them. So not putting it into your plate to be getting people up to speed on preschool promise, but really acknowledging that that's our role with the preschool promise program. And so helping those people get onboarded and up to speed on those will be a responsibility that we'll take on as a support. So we're looking at doing that a couple different ways. Obviously, our timeline has shifted from what we were originally envisioning of bringing people together in July and having some in-person trainings around preschool promise. That's obviously not happening, and that's okay. We're going to shift around that, and we're going to be able to individualize a little bit more. So it may end up looking like some small groups with the sort of first wave of hires. It may end up looking to be a more medium-sized group, but we are committed to developing some materials that can be used as supports and also onboarding pieces, as well as how we can support these folks through ongoing PD and getting their own coaching. And so we are looking to contract out with 2 mentor coaches in the state that will coach coaches, and that will be an additional support for those folks as well. So they'll be getting additional professional development that way, as well as looking at creating our own community of practices. So similar to how John and Dana do community of practice with our infant toddler specialists, looking to see putting together community of practice with our preschool promise specialists. And I think the other thing that I want, or 2 other things that I wanted to just highlight and bring our attention to, is when we talk about helping these providers get up to speed with preschool promise standards or implement preschool promise standards. Sometimes I think that leads us to the question of, well, what are the preschool promise standards? Do we need to learn new standards? For those of you who may have worked in the Head Start world at some point, learning performance standards, there's over 3,000 of them. It can feel intimidating. And I just want to say, you know, one of the reasons why we think that you guys are in the best position to help these programs succeed is that preschool promise standards are SPARK. SPARK is preschool promise standards right now. And so looking at SPARK and looking at also Governor Brown's executive numbered memo back in February around early learning standards, which I can send out to everybody so we don't all have to go digging for it. Those are really the 2 documents that that help guide our preschool promise program standards for this next year. And we'll be providing more materials on articulating that out and supporting how to communicate that and how to help providers understand that, and then also how to take those standards and put them into the world that we're going to be living in for the next program year. And what does that look like, and how do we identify and individualize those supports? The last thing that I would say is just a reminder that for preschool promise expansion, right now we're in a period where we have sent out intent to award letters. It does not mean that a contract has been finalized or that that award is finalized yet, but there's still an appeal process, and then there's still some contract negotiations. And within those contract negotiations around the grant, that's when we expect to have conversations around needing to get new programs up and running and licensed, needing to have conversations around what needs to be purchased, what is doable now. And we understand that for some programs, the original timeline of having children in programs by September 1st just isn't going to be doable, and we're going to work with programs around those. So I just want to emphasize that.
So I imagine there's some hands raised. Where are we?
We have Toby and then Shannon and then Karen.
Hi, this is Toby. My question is, how are you figuring out FTE for these positions for CCRR when you had Preschool Promise 1.0 and you had people helping those programs? How is that going to change to us or revert to us, or are they still going to provide the support, and then that's how you're going to figure out the FTE for us?
Andy, I'm not sure.
Toby, I'm sorry, I had a cough, a tickle in my throat, and I missed about half of your question because I was coughing. Do you mind just repeating?
So we have Preschool Promise happening right now, and obviously there's probably people helping those programs. How is that affecting our FTE for the new staff that we get? Are they going to continue providing for those programs, or is everything switching to us?
So for people who have been in Preschool Promise before, they were subcontracted through the early learning hubs, and we've moved those contracts from the hubs direct with the ELD. And so those folks will not be receiving that same support from the hubs, which is why we are able to offer additional funding to the CCRNRs and create a better fit there. So unless they're an OPK or in a school district, they will not be receiving the kind of support that they have before, which is really the creation of these FTEs. Does that answer the question, Toby?
Somewhat. I'm just trying to figure this out.
Okay. Yeah, I would say if it's an OPK program, they are still receiving those same supports that they have built in as part of their requirements, and that was taken into consideration when we were looking at FTEs and our total budget for FTEs. And like John said, the FTEs is based on how many intended providers in each region. So if we have a region that's really high in intended providers and slots, but we know that a lot of them are OPKs or school districts, but then we have a region that maybe isn't as high, but we know that the majority of those programs are not supported through OPK or through K-12, and we had to make any adjustments so that we were still within our budget. That was one thing that we looked at and thought about.
Okay, thank you.
Sure.
Anna?
Hi there, can you hear me?
Yep.
Okay. I'm just curious on, so what the programs who have applied, do they understand about these positions? Do they know about these positions? Are we going to have to struggle with buy-in? I mean, what do they know about this?
That's a really great question. And you know, it's hard to say exactly what do they know. We definitely found through the RFA process that there's a lot of information in the RFA, and some of it maybe wasn't as digested as well as some of the other pieces, but we definitely have tried very hard to communicate out that there will be supports available and that there will be coaching available to Preschool Promise providers. You know, now that we have the intent to award and we can start going through that, then what we're looking at is creating a welcome packet for our Preschool Promise providers that are coming on board as we confirm and finalize those contracts. So we'll be able to say, hey, here's what you can expect now that you're in Preschool Promise, and including in there. And one thing that I've been thinking about, and I don't know if we want to get into this now, but something for us all to think about is how can we include you guys in that welcome packet? Is it a letter from the CCRR just to introduce yourself? Is it, do you have any marketing materials, that kind of stuff, where we can start in that welcome packet to create that connection there. My hope is that there'll be buy-in because it's support. My hope is that there'll be buy-in because it's education and it's training and it's coaching, and that people will welcome that kind of support. But we will obviously continue to work on all ends to help build those relationships.
Yes, I really appreciate it. I hope that you can be a bridge, I think, to those new staff people, to those programs.
Yeah.
Andy, it's Joan. I guess I'm wondering if I might just add to that, if that's okay with you.
Absolutely.
Yeah. I think that what we're really going to be trying to do with both the early learning hubs and their role in coordinated enrollment, as well as the role you all will be playing in terms of supporting the success of these programs, is like that's baked in to being a Preschool Promise provider. It's not, oh, I can do that if I want to, but if I don't want to, like I can enroll my own kids. No, you will, you know, if you're you will be working with the Early Learning Hub. I mean, obviously there's some variations on that with OPK and some special considerations potentially, you know, with schools, but I guess I want you all to understand, like, this is how Preschool Promise program operates. It operates with these additional contracts to support the success of the providers. So I think what I would be saying is, how are the staff that you all will be having building their skills at building rapport and having strong relationships and providing effective assistance, because that's where the real buy-in is going to come is the difference that those folks are going to make for these programs to successfully operate. And like Andy said, like that is work that ELD will be doing kind of hand in glove with you and the mentor coaches.
Karen?
Hi there, it's Karen Hinkmeyer. I'm curious about how FTE is thought through. I definitely want to have a conversation about how additional positions need additional supervision, as well as admin for additional individuals taking trainings, et cetera. And so, you know, wanting to really understand how this fits in the R&R, which is where I believe it does. You know, we're adjusting Lead Learn Excel from a school system to a preschool system to family childcare, which is very different. Head Start programs and schools have an HR section to go to where our staff will be that support. Contract, they have support with their fiscal department. We will be that support for businesses, for family childcare, for the business support. So I am curious about how we fund the structure of Preschool Promise, not just funding the people on the ground. And there's also additional with hub coordination, just trying to understand it all as a big picture and not just a couple of staff to help with individuals going through Preschool Promise. It's how do we fund the system?
That's a good question. I'm curious if there's anyone chomping at the bit to start answering that. We can tag team it, but
What I would say is, Karen, that we're well aware that I guess I just really want to go right towards like, does ELD understand that you all will need to supervise these positions and that adds additional staff? Yes. Do we understand that bringing on additional staff brings additional expectations? Yes. Did we receive all of the money that we hoped that we would from SSA to be able to support every aspect of this expansion? No. Will we need to work with you to do the best that we can with what we have? Yes. Can we answer all of your fiscal questions about FTEs and how much money you're going to get and et cetera today on this call? Unfortunately not, but I guess I just want you to know, like, we're not sitting here thinking, hey, let's just give these folks 2 more positions and there's not going to need to be any other changes and any other expectations. So I guess that's the bottom line of how I would address your question at this time.
And I think as far as timing goes, I think we are very close to being able to give you guys a picture, a draft of the statement of work. And I noticed in the chat box there was questions around, is there going to be job descriptions? Essentially, this statement of work functions as a frame up of those job descriptions because it's an amendment for this body of work. So it really does describe out the details of what both those positions are expected to do. And so that draft is, I think, very close to being sort of ready for sharing. And so I would imagine that we will be able to get that to you fairly soon. And I would think within the next week, if not sooner. So I could be jumping a little far ahead on that, Andy, from your perspective. I don't know if you think the timeline is longer, but it felt like we were getting pretty close.
I think we're very, very close. Yeah.
And so that's a component of what I know everyone's hoping to see and wrap their mind around. And then I believe the next piece would be able to, for us to be able to share what we believe the FTE funding levels will be, and how much each region is going to get, and that I think is probably going to come fairly close on the heels of the statement of work draft. So I see Jerry's hand.
Hey, so I have one thing I picked up when you were talking about these positions was that, excuse me, if there was programs in a school district, that somehow that was different. So, and I wrote this in the chat, but our region does not have preschool promise. Some of our preschool promise awardees are in school districts. Will we not be supporting those people with these positions you're talking about? Is there going to be something baked into their contracts to deal with that, or will we be supporting them?
So
yeah, I think that's a.
Oh,
go ahead, John.
We all unmute at the same time. Okay. My perspective on this, and then others can say from our team can add nuance or change my response. But I think if I were in the CCRR role doing what you guys are going to be doing, I would assume that your role with the FTE that you're going to receive is to support all of those programs that are going to be funded, and to come at it from the perspective that that you are the TA for the region for those programs, and that you are sort of stepping in to have those conversations with a school district, with a Head Start, with a family child care provider, with the same sort of confidence and expectation of what you want to be providing for those folks in that region. And just, and then as you bump into whatever those, because we all know that there may be Head Starts that have an infrastructure and a support system and, coaches that they currently have. And so your role may look a little different based on their current structure, but some Head Starts are going to potentially really value what you're able to provide, and you may already have partnerships with them to do that. And so then when you look at school districts, same scenario. But I would come at it from the point of view that Preschool Promise has this, as Joan said, baked into its design, and you are the TA, and confidently step up to those school districts and say you're here to help them out. And then as you inevitably may get resistance or some varied version of how they think they are structured and already capable, we can help work through that process with you. But I'll pause there because I think, Joan or Andy or Margie may have other thoughts to add.
And Eva has her hand raised as well.
Yeah, I guess I would say that I thought that you did, from my perspective, a great job, John, in talking about the expectations. I mean, obviously, we're all starting this work together, so we have to be realistic with the fact that you're potentially going to be hiring some new people. Perhaps you have people on your staff now who are eminently qualified for these roles. And so you may, be making internal hires. So, I mean, it is definitely a developmental process, but we're dedicated to supporting your success. And we have 179, if Dana Young can tell me if I got it wrong, but I think that's right. People who are super excited, my friends. They are thrilled. They are honored, some of them. They can't even believe that they have this opportunity. So, I mean, I don't want to lose sight of that in all these questions, is that we've got a lot of goodwill to capitalize on here, and coming at such an important time with so much, this is very hopeful. And I want us to be able to continue to tap into that we got this money, we have this opportunity, and this will help many of these providers in particular be able to stay open and stay in business. So I'm confident that you all are the right people to help lead this work, and I have made the case for you over and over again, and I am convinced that we can work together to be successful on this.
So I just want to say, I've already had a really lengthy conversation with one of our school districts, and they had put funding in their grant to have their own support person, and they did note that they didn't get as much money as they asked for. They haven't obviously they haven't gotten their grant yet, so they don't know what the specifics are, but I suggested to them that that part of the reason was because that support system piece was going to be provided both by the state and the CCRR, and that we were a part of a team. We would be working together in partnership with our early learning hub, and I talked it up pretty big. So it took a while, but what I don't want are school districts who think that they know what early learning looks like when they don't. And I'm not going to say that that's true in my area, but I have been in facilities where you walk in and you just go, oh my gosh, there is way too much furniture in here. How does a child even move? It's all little, but it's not a developmentally appropriate environment, and that's a school district program. So I really want to value what the CCRR system, what the state has to bring to bear for these school districts to really understand what a high quality developmentally learning environment. And I think we all have a lot to learn from each other. So
I think that's a perfect example, Jerry, of putting yourself out there in a confident way to say that this will all be a partnership and connected, even without having the details in front of you of how this is going to roll out. And that is one of the things that I am hoping that everyone here can really embrace, is just as you know, Preschool Promise potential programs here have the information that they have an intent to award, and you have a list of who all of them are, and as you're interacting with them, coming at this from the point of view that even though you don't have your grant yet, that they realize, that these providers realize that you really are their TA system, and that you will be engaging with them over time. And you know, even if you're introducing yourself now, because some of these providers you're well connected with already, and some this is going to be a new partnership, but I would just say the more that you can do exactly what Jerry did to kind of talk it up and show that this is all going to be connected together, the better. And then we're doing our best to rapidly get you information to fill in the blanks on what you don't have around the details. So
just one other thing, and that is, I don't want the school districts to be separate from the home-based childcare providers. I mean, some things are going to be different, but I think there's real value for them each to learn and understand from each other. I think there's a potential for a school district to think that they know it all, and that these little preschool promise programs that are in a home-based program are not as valuable or as good. And I think if we're all working together and we know each other, particularly in small communities, that we develop a respect for the work that we're all doing for the benefit of our children. So that's my last 2 cents.
I could not agree more. And I think that we had a lot of home-based childcare providers, particularly folks closely associated with AFSCME, that really were under the impression that schools were trying to put them out of business during this whole emergency childcare situation. So I think we need to go into this with our eyes open a little bit, that we do have a lot of work to do to help our various providers of important early learning services have mutual respect for each other and for schools to really understand the important role that childcare plays. Now, obviously, that isn't the same need everywhere, but it certainly showed up as a very difficult issue during this pandemic. A lot of really, really difficult feelings associated with schools and childcare. So.
This is Dana here, and one thing that I did wanted to go ahead and add is as we're moving forward with this next implementation, I know that everything seems a little bit uneasy and we may not have all the answers to the questions, but what I think is really cool and really important to the CCRNR's role is that in this like preschool promise special coaching positions, you will not have to like deal with a lot of some of that. We learned a lot from the previous implementation, so a lot of those contract specific reports, fiscally staff, that will be handled directly by the ELD, which really puts us in that position to go ahead and ensure that our processes are equitable, that they make sense. So you don't, you will not have to go ahead and deal with insurance. Insurance was a big topic from the previous implementation and created a lot of barriers. So that will be something that we will be able to go ahead and handle directly, which really just puts you in that position of like, let's help you with those preschool promise requirements. Let's go ahead and talk about the environment versus having a conversation like, oh, we got to go ahead and help you find insurance, right? And find all these other things. So that will be, that's something to go ahead and keep in mind, that as far as some of those fiscal pieces, supporting pieces, that will be handled directly by the ELD. Sure, I think there's always an option for you to be able to, what are some of those reports, because if you are going to go ahead a very close connection with these providers, I'm sure they're going to go ahead and ask you, right? So I think that, look forward to go ahead and just at least giving you some of those pieces, but that's something that you guys will need to worry about. It's really that coaching, that quality, that service to that children, which I think it's going to go ahead and help us with successful with preschool promise. Thank you. No, insurance was a big topic, previous implementation. So thank you.
Heather and then Eva.
I was just going to say that I really appreciate the conversation about some clarity with schools, having worked with schools with Preschool Promise for the last few years. It's just really important for them to understand the support that they have available to them through this process, and completely agreed with Christine in the chat box of how valuable it was to all of the Preschool Promise programs to be able to meet together, and whether they were, ours were all in schools, we had one in Hawaii, but I'd encourage people to ask questions about outside observations and some of their policies in their schools, and just on the ELD side, just bringing clarification to, how do I, what kind of contracts do I have with my staff that, can they be paid for attending an extra meeting or doing those things? That seemed to be some of the challenges that we had. Some of the schools would pay for those things, and some of those teachers came because they just really needed the support and they didn't care if they got paid or not. So it was just kind of an interesting process, but certainly valuable and valued. So, but those were things that I think didn't necessarily have a lot of clarification through Preschool Promise, because ours was a side grant, but very valuable. But it was important that the principals and the superintendents understood those kinds of things, those things that might be outside their contracts.
Eva?
Thanks. I just wanted to go back to the beginning of this piece of the conversation, and Jerry was talking about how we support schools, and John and Joan both filled in. I am really excited about this. I think everybody knows that my other half of my hat used to be Preschool Promise Manager for our Early Learning Hub, so I'm really excited about this coming back to the CCRR. I think that like Jerry said, our schools need us to know what's developmentally appropriate for students. A thing that was challenging for us in Preschool Promise with our hub was some alignment of definitions. And so I want to come back to something that I put in the chat, and that is making sure that when the statement of work comes out, as coaching, instructional coaching is defined, that it aligns with what K-12s define instructional coaching as. I think that's really important as we connect with schools, that our process for instructional coaching is the same as what they expect within their system. And that it's also really important for us as a grant within an ESD. Our ESD is we're hiring instructional coaches are going to have a specific job description and definition of instructional coaching, and so that those things align, so it's not extra hoops to jump through and misalignment that causes confusion.
May I ask a question, Eva?
Yeah.
Does every ESD use the same position descriptions for instructional coaches? Is that what you're saying? Or are you saying your particular ESD has a definition and a position description?
I'm not sure about other ESDs, but I know when this came up in conversation several months ago and we were talking about these positions, I talked to our director of instructional services, and within our ESD, our CCRR staff are classified staff and our instructional coaches are certified staff. So there's a whole different union structure, a different job description structure, and she was very concerned about the alignment and how that would look for hiring for our agency.
Okay, that's helpful. We may want to follow up to talk to you further, depending on how things go. So,
thanks.
This is Margie. I just want to mention we may want to connect with the community colleges around the job descriptions as well, because I believe a couple of them have brought up their specific guidelines in positions there, so we want to make sure they all align. We might have to maybe have a couple representatives to take a look and make sure we're on track.
Yeah, I'll just say that real quickly. As far as community colleges, the only thing that's kind of on my radar that like we can usually get around the kind of stuff Eve was talking about just by like changing the working title versus the classification or whatnot. But one of the things, and it didn't end up being too big of a deal because they never like officially got into the contract, but with the operating guidelines where it talked about QIS, one of the issues there that we had was some of the minimum qualifications would have placed our staff at significantly higher. If they had those qualifications, they'd be in a much higher classification than our other than the QISs we'd hired. So for us, the thing that would be good to keep on the radar would just be where, how in depth you get about the specific minimum qualifications for people in the position. We did bump up against that.
And sorry about this, Taya, but it was either cutting out on my side or fading on yours. Which position were you comparing that to where the classification?
Oh, so I was just thinking like what Eva was talking about. I don't know we'll have an issue with this. What did you, instructional coach, I think was the right word. So what I'm saying is we can usually, even if we have something like with a similar title or the same title, we have some workarounds for that. By like if ELD wants us to say this is an instructional coach, that doesn't mean they can't have a different like in the background classification at the college that is not the same as instructional coach. Does that make sense?
Yeah, I'm following.
Silly, yeah. Okay, yeah, that's what I meant by that.
That helps me great. Thank you. Sydney, are there other people in the waiting?
Not seeing any other hands.
There was one comment from Mary, related to how our business support's going to be delivered. And I really think that business supports, and it kind of relates to the comment I made earlier around the preschool promise specialist. Like in a perfect world, we would have this system of supports with all of the focused childcare network work that you guys are doing that would prepare childcare providers to be sort of ready for public funding, right? And then they'd move into this preschool promise opportunity, and then the instructional coach would sort of take charge and really focus on this individualized support around preschool promise. But we don't have that in every case. We've got some preschool promise funded programs that have come from great supports in a focused childcare network and are moving into preschool promise now, and that's perfect, exactly what we want to have happen. But how it's working now is that we have both of these positions focused on preschool promise that are going to be in your organizations, and both sets of activities are going to happen simultaneously for some. There's going to be brand new providers that are getting preschool promise funding that really haven't been in a focused childcare network, that could significantly need business supports and other foundational supports to really be able to be the best they can be, to then start receiving this coaching component, which is really a more in-depth, very individualized process to meeting those preschool promise requirements. So I think, in answer to sort of Mary's question, business acumen is going to be a huge component of this work for people that are in need of that support. And I think where we're headed on our side is making sure that we are finding some train the trainer opportunities to embed in your teams. You know, some of you have business training components and supports that you're providing, and of course it's a part of your base level of services. But I think we really also want to have, for all of these new staff that are getting hired, some level of training to support them in having standard process to help people run businesses appropriately. We want to start thinking about how we might coordinate some shared services opportunities that, you know, technology use, so that providers are able to access that as they're increasing their level of engagement in a public funded program. All that kind of stuff we need to start kind of working toward. But business and that foundational piece would definitely be part of the TA that's provided.
This is Dana. Just to go ahead and add to the topic of like business support and acumen, I really think we may need to go ahead and start defining like what is business support, right? And what is it that we really mean when doing that? I know in the previous implementation, some would go ahead and treat business support as helping the provider fill out their like monthly reports that the HubSpot requirement, and really doing a lot of those business stuff. As you guys all heard, we didn't move forward with a fiscal agent. So I think that provides the opportunity for, you know, like what John was saying, to go ahead and see, okay, what is some of the capacity of expanding some of those resources of the CCRR. And then at the same time, even I'll go ahead and use reporting, for example. Then it's going to go ahead and put us in a little bit of an opportunity to ensure that reports are not going to go ahead and cause barriers. So I think that's the other side of it, is like, what is really business support? And when we say business support, what are we talking about? Are we talking about a provider working with a small business development center and touching on their marketing and advertising and, you know, some of those specifics on their fiscal? So I think there is that. I think business support is going to be quite that, almost its own big circle of topic, because everybody's going to be at very different stages. Some of them are going to go ahead and need help hiring staff as they're going into preschool promise. So really look forward to just trying to verify. But I think what I will go ahead and kind of pose it to you guys is, when you guys are saying business support, it's like, what do we mean? Because I have the feeling that we all have in the business support. And also for the provider, they're going to be in different stages as well. Some of them are already like in cohorts, the Small Business Development Center. They're already getting that, you know, business support. So I think that's going to go ahead and require a deeper conversation on that to really. We do have, and we are hoping to go ahead and launch that with the implementation is in collaboration with the Secretary of State in that business support. We have a template that has all the business resources locally for providers that they can reach out to. So just in thinking, it's like what does that mean, and how do we connect providers to it? And I think it's all going to depend like at what level are they at. Some of the expertise we're already working with entities like Hacienda CDC up in Washington or just something for us to go ahead and like noodle on as we continue with Preschool Promise there. Thank you.
Thanks, Dana, for the comment there, and also I think the considerations around what a large bucket we're talking about when we're talking about business supports and what could possibly go into that, and what role and who plays what the supports are and what organization is lead on those things. So we are nearing the end here of our time with just about 4 minutes left. And I think Shannon was saying that Dana was cutting out a little bit, but I think the sentiment came across that defining what we mean by business and who's taking the lead on what aspects is really an important aspect that we'll continue to talk through. Any last questions, comments? I see Jerry says, TA staff at their organization are in positions called Family Connections Consultants. And we do realize that there's ELD's version of titles, and then there's each organization's sort of categories. I think the important factor to really be thinking about here is, and I think we learned a little bit when we were working on the infant toddler.
3 minutos.
What was that?
3.
I don't know what that was. Okay, so anyway, I think the part that we learned around the infant toddler specialist positions is that we really wanted them to be categorized at a fairly high level, and in many organizations, the job descriptions didn't necessarily translate to being classified at the levels that we were hoping that for those to be classified at. So especially with this instructional coach position, we're going to want to work with you guys to make sure that it lands at an appropriate place within the expectations, so that it gets classified in a way to be somewhat of a higher level position. It's got some very distinct areas of focus, and we just want to ensure that we're paying that appropriately within the structures that you guys have in your organization. So more to come on that. We will get back to you as soon as we possibly can with some draft language, and just be aware that the statement of work, when it does land for you to be able to read, is draft. It won't be the final thing that necessarily ends up in your grant amendment. Timing wise, we have to get this through procurement, which takes a period of time. We're going to try and get it moving as fast as we possibly can, but imagine, it could be a 60-day process to where some organizations have the ability to kind of start thinking about and opening positions and others don't. So we totally realize that this is going to be something that some of you are going to have to wait until that executed grant is in your organization before you can even open up a position. I hope that does not stop you from at least, drafting everything and having it ready to go as soon as the executed grant is there. And we also realize that recruitment is going to take plenty of time also on your end. And so we are doing our best to get this moving as fast as we possibly can. And the more that we can provide you in draft format, the better you'll be able to at least be able to speak to what the future of your connections are going to be with these Preschool Promise programs. And I think that is what we're really trying to achieve now, is give you the tools that you need so that you sound intelligent and are speaking to the facts and not sort of making it up on the fly, which we know we all have to do on occasion. But I think that those partners that have gotten their intent to award need to see you guys as exactly what you are, the professional development system to support their preschool promise implementation. So we are at noon. If there are other questions, feel free to message Margie, Andy, or I if it's related to preschool promise. If there's other things that kind of got stuck out there in the world that you didn't get answers to, Margie and I can help work through that. So thank you all. Have a great and wonderful rest of your Tuesday. And I think we will be seeing a majority of you again on Thursday, correct? We have our aptly named monthly meeting, which is just basically another opportunity for us to meet with you multiple times in a week. So we'll talk to you all again soon. Thank you much.